this episode of the Aging Well podcast, we're joined by Sydney Rosbury, a pre-med senior studying neuroscience at the University of Michigan and a passionate advocate for affordable, personalized elder care. As a student caregiver and a public health ambassador with CareYaya, Sydney represents a groundbreaking model that connects college students in healthcare-related fields with families in need of at-home elder care. Backed by institutions like the Harvard Innovation Lab and AARP's Age Tech Collaborative, CareYaya addresses the growing challenges of elder care with innovation and compassion. Whether you're a part of the sandwich generation, juggling caregiving responsibility, or seeking meaningful companionship for yourself or a loved one, this episode offers insights into a service transforming elder care. Well, Sydney, welcome to the Aging Well podcast. Can you share a little bit about yourself and your journey into neuroscience and what makes you so passionate about elder care?
Hi, so yes, I'm Sydney. I'm from Michigan. I'm currently a senior at the University of Michigan studying neuroscience. I have a minor in the sociology of health and medicine. So as I've gotten older, I've realized how important it is to consider the social determinants of health, especially as a future healthcare provider, because I do plan to go to medical school after graduating. I'm going to take a gap year or two, but then apply to medical school. And so I stumbled upon this incredible organization called CareYaya. It started off as a summer job, but I've continued as a caregiver with them for about the last year or so. And I really support their model and how they go about providing affordable elder care to Americans. And we have a lot of locations throughout the country that we can provide care around.
Yeah, I'm really interested to kind of hear about what's going on around the country and how students can get involved. But what drew you to CareYaya's mission and how does it align with your goals as a pre-med student?
Yeah, that's a great question. One thing I really liked about CareYaya is the model that when patients sign up to receive care from a CareYaya caregiver, the money goes directly from the patient to the caregiver. There's no fees, there aren't any, the organization itself is not taking that money. It's going straight from the patient to the caregiver, which I thought is really cool and not very common these days. And it just kind of supports the idea that CareYaya believes the most well compensated caregivers, because we're not getting any money taken away from us, we're going to provide better care than maybe an organization where the caregiver isn't as motivated because they're not receiving that compensation.
Yeah, so how does their model connect college students with families and those needing, elder care? And how does that differ from more traditional caregiving services, other than what you said, that most traditional caregiving services are going to be taking a cut and paying a part of that to then the caregiver?
Right. So we have locations, actually, there's a pretty long list of schools that we offer care. The rule is that within a college, a 45-minute driving radius is generally the area that a student is willing to provide care to drive to, because most CareYaya caregivers do have cars. There could be some exceptions to that, but right now there's a whole list of where is CareYaya active on our website. But there's schools in California, Florida, Georgia, Massachusetts, Michigan, North Carolina, South Carolina, Texas, and Washington, D.C., where CareYaya has expanded so far. And we're looking to expand to include more schools. Generally, they pick a pretty well-known university that has motivated pre-med, pre-health, pre-dental population of students. And then we are the students who end up providing the care because it helps us get hours for medical school or dental school. It helps us get patient care hours that we need later on to apply to secondary, like either grad school or professional schools.
Right. And so can you share a story or an example of an intergenerational relationship that has had kind of a meaning impact on you or maybe on a fellow caregiver?
Yeah, for sure. So one that stands out to me in particular is there was a woman I worked for in the summer she was just very, very kind, one of the kindest, most open-minded people I've met. And it was kind of cool to compare and contrast some of her beliefs about the world and her perspective of the world with other people I know that are around her age. She was the same age as my grandmother's. But her and I, what she wanted to focus on was doing things that brought her joy that she wasn't really able to do on her own. So I would help her garden. I would help her. She liked to iron, but she couldn't do it. And she asked me if I knew how to iron. I was like, yeah, I can do that for you. So I ironed all her clothes because appearance was something that she felt like she wasn't up to par with as she aged. She wanted to kind of feel like have the appearance that she did when she was younger. So I would help her with that. It was just a really fulfilling experience getting to work for her. She was a former professor at U of M, and I got to hear about her academic career, her family career, her personal things in life, and her travels. And it's just really inspiring to have other people to look at and see their life and be able to decide what aspects of theirs you might want to emulate in your own.
Yeah, that's, I think, such a fascinating aspect of this is that, one of the important things that we can do to really help both your generation and the older generation is to bring you together and give you those opportunities. And I think there's a very missed opportunity to bring college students and older adults together, as well as, older adults and even younger kids, like, having them involved with kindergartens or, elementary schools and reading and things like that. So what are some of the most significant challenges you've observed in elder care, and how does CareYaya work to address those?
Yes, for sure. So I would say the biggest issue that I've noticed in elder care is just the discrepancy in the quality of care given depending on where the patient is receiving it from. Because not all elder care facilities are created equally. There's sometimes people working minimum wage jobs in those industries, and they're just not very motivated to provide the highest quality level of care that is possible to administer to those people. So what I really like about CareYaya is I believe it's only 20% of applicants get accepted to be caregivers, and all of these applicants are college age students. Some of them are recently graduated college students, but so it's a bunch of 20 to 24, 25-year olds who are really eager to get some work experience that is going to help them later on in their career. They're people who are generally pretty educated about science and medicine and health and are willing to incorporate like new information and new research into their care that they provide.
Yeah, I think if I had an elder that I needed care for and I was in close proximity to a university, I would be all over trying to find college students. And that's one thing I've appreciated in my years as a professor. I teach exercise science. And so, when my son was born, we needed babysitters, and I taught athletic trainers, as an exercise science professor. And it's like, who better? Or a
Right.
bunch of pre-med students too. So these kids that had a compassion and care and were being trained in how to do these things. And so I think that is a huge benefit to something like CareYaya, is that you are not only bringing energetic college students to interact with these people, but they have a certain level of expertise that can benefit you. That if something goes wrong, that person at least has some level of training to care for that, rather than just somebody who you hire off the streets, more or less.
Right.
Sounds pretty
Absolutely.
bad. I would hope nobody would hire somebody off the streets just to take care of their elder.
Yes, I feel like that is probably one of the most important decisions in selecting who is going to be giving care is for your parents or your grandparents. So it's definitely a thing that you want the person to be well vetted. And a good portion of our students do have EMT training or CNA training. Personally, I did not. I just had basic life support training and like adult pediatric first aid and CPR. But there's an option to check what kind of training you have when you're applying. And I believe when you're matching with a family too, if there's a family who might prefer a little bit more training, it'll say on the caregivers if whether we're certified in a certain thing. So that's kind of a cool little aspect of it.
Yeah, that it is. And so kind of that talk about having kids, picking somebody to care for your kids as opposed to somebody to care for your elder, your grandparent, your parent, or whatever, whoever you're in care for. You've mentioned like the sandwich generation, I think, as we communicated before this interview. How do you think, well, first of all, what is the sandwich generation, and how do you think services like CareYaya contribute to alleviating the caregiving burden for this generation?
Yeah, so the sandwich generation is essentially the generation of adults right now that have both kids and parents that they need to care for in some capacity. So that could look like young children and maybe parents who are experiencing some health issues. It could look like someone having more adult children, but they're having issues with real like older parents that have dementia or Alzheimer's. That's kind of the case with my parents. My brother and I are both in college now, but I see with their moms the type of care that they have to provide, and it's a lot of stress for them. And I would like to help alleviate that stress for other families as well as my own by doing what I can, especially having an interest in the healthcare field.
Okay. And you've kind of alluded to this already a little bit, but how does being a caregiver benefit college students like yourself, both professionally and personally?
Honestly, it is just such a good way to have conversations with people, which I feel like can be really overlooked, especially in medicine and just even in science communication right now. It's really, really fulfilling. And I think it'll be helpful to me in my future career to understand how people think, how people receive information, how they process the news that they hear online or they read about in articles. And I get to have these one on one conversations with them about science, about medicine, about a condition they might have, and get to hear their perspective on it and maybe some things that their provider has overlooked so that in my future studies and career, I can keep that in mind and think about how are the suggestions I'm giving, the advice I'm giving to my patients, is it being well received by them, and what do I need to do to make that happen?
That's a really, really good point because I think a lot of doctors anymore, they go through programs, and I'm kind of biased being an exercise science professor. I tend to think that all medical students should go through an exercise science program. And I know you're going through neuroscience, a little different, but it's quite often that pre-med students go through these basic science programs and they don't learn to interact with people. And so patient comes in and they get that very short 15 minutes with them, and it's all about what's on the chart, here, take a prescription and go, as opposed to, as we like to address on this podcast, we talk about, like, for me, exercise science and medicine would be in the same kind of under the same umbrella, but we talk about biomechanical psychosocial. And a lot of times medicine is just biological, and we forget about the social and the psychological aspects of that. And I think a program like CareYaya really helps to underscore that need for empathy, understanding, communication, and building relationship with your patient. So I think I think it's an awesome program. That's why I was so excited when you reached out about, hey, I saw your program and I'd like to, maybe come out here and, be my ambassador for CareYaya. And I'm like, absolutely. This is an awesome program. Why don't we have this at Western Oregon University where I teach?
Right. We need to expand to the Pacific Northwest a little bit more, as well as other areas. But yeah, thank you. I was really excited to hear about this opportunity to be a part of like CareYaya, and I'm glad that I came across it. And I do feel like you said, building trust and building camaraderie, having a good patient to provider relationship is crucial in the delivery of healthcare. Because if you can't bridge that gap and make sure that your patient understands why you have a certain recommendation and where you're coming from, and you're not hearing them and their needs and what they're concerned about, like that's just not going to get successful results. You need to have a good relationship. So I think that CareYaya really helps develop those types of skills and kind of clues students into what kind of questions to ask and to observe and notice and ask questions about what you observe and notice.
So what kind of training or support do the students receive through CareYaya?
Yes. So when you are hired initially, there are modules on common things that you might encounter as a CareYaya. So you learn about fall prevention. You learn about, there's a pretty sizable like memory care module about dementia and Alzheimer's. And basically, CareYaya gives you a ton of resources to read up on so that when you're going into someone's new home for the first time, and you may have read online, they state what their condition might be, that you're prepared. and you know what to expect.
And so CareYaya has quite an impressive backing from things like the Harvard Innovation Lab and AARP's Age Tech Collaborative. How do these organizations support and help the organization grow and evolve?
So that's a really good question. It's my CEO Neil would probably have a lot more to say about that than I do. But the I would say that publicizing CareYaya and advertising for us, having backing from those trusted organizations has been really helpful. Just because nowadays it's kind of hard, especially for someone who might be in the older generation, to tell what is a scam and what is real. Um, but having like all of these there's a lot of good Google reviews. There's the backing from AARP, Age Tech Collaborative. Those are going to kind of reassure potential patients and potential clients that, yes, we are real. We are a reputable organization.
Yeah, just not a bunch of college scammers that are
Right.
just...
College scammers trying to take your
Right.
money. Nope.
So what are the future goals for CareYaya and expanding their reach and their impact? I know you said you want to see more institutions taking on the program. So
Yes, because essentially we are a database for caregivers. We are not a home care agency, we are a registry. So it would essentially be just creating an even larger amount of vetted and trusted caregivers. And then that would allow us to expand based on where those caregivers go to school and where they live. So that's one of our goals for expansion. And then another one is our CEO is working on an AI model to kind of help with elder loneliness and some mental health issues that come with the social isolation of aging, and kind of sometimes encountering loss and maybe losing some of the people that are part of your generation.
So how can families then that are interested in CareYaya's services get started, and what should they expect in terms of the cost and the whole process of just getting their elder connected with a college student?
Yeah, that's a great question. So we go through careYaya.org. It is a website where you go to sign up. It does not take long to sign up, but right now we don't have a working phone number. The website, you go and you can go and click, and it says Find Care, and you click on Find Care, and depending on your state, there's a minimum wage that the student will receive. In Michigan, I believe it's $17 an hour. So that is what, depending on the number of hours that the patient wants to have of care a week, sometimes it's a little bit higher if they only want a couple hours. But if it's between 6 and 8 or more than that, then it'll be the minimum required like wage requirement. So they're paying $17 an hour directly from themselves to the student, which is a rate you cannot beat with other organizations like Visiting Angels, for example.
And I understand that, there's no need for a phone number anymore. I mean, who actually uses phone numbers?
Yeah.
And I think, it just makes it a much more streamlined approach, I think, to be able to just do it through the internet and, just go online and log in, get the information, and get connected.
Yeah. So, the only downfall, I guess, of not having a phone number is that we have had a few instances where an elder is trying to receive or sign up for themselves, and they have a little bit of trouble navigating the website, but which is understandable. But we do have a pretty small team at CareYaya that is in charge of vetting patients and people to be able to receive care in the database. So those people are very willing to help, and they're very personable, and they can help you like go through the online process. There's also a chat bot on CareYaya, which I don't know how helpful that will be to everyone trying to use it, especially those in the older generation, but there are ways that we just have to persist a little bit and get you signed up.
Yeah. So what advice would you give to families that are navigating some of these challenges of elder care for the first time?
Yeah, so I would tell them that respite is really important, and your ability to provide care for your parents or your grandparents or your spouse, whoever it may be, brother or sister, is really dependent on the balance in your life and making sure you're getting enough rest, you're getting your needs met. Because it's really hard to provide care for someone else when you're constantly just kind of berated with the challenges of life and having to juggle your own responsibilities with responsibilities for another person. So I would say we give a really robust opportunity for you to get some respite if you are someone who is in charge of caring for a loved one.
So I get it's with somebody who is in that sandwich generation and they have maybe both ends of the spectrum that they need to, to care about. Does CareYaya do anything with that where, you might be able to provide care for both the, the say grandparent and maybe a young child? Do they do any of that?
So we can do right now, as of at this point in time, we can provide care if there are, let's say, like a couple maybe that needs help, or a brother and sister that live together, or siblings that are part of the older generation. So far, we have not expanded our services to include taking care of children, because we don't necessarily have the training capacities for that yet for our caregivers. So in the future, that could be something we look to expand, is help with both ends of the lifespan like that. But right now we are focused more on elder care.
Okay. Now you are the youngest person I have asked this question, and the youngest person to be a guest on this. We ask this question of everybody on the podcast. But what are you doing personally to age well?
That's a really important thing to think about. I am really focused on getting enough sleep, and I always have been. I've always been a really big sleeper. And as a neuroscience major, I've come to really appreciate the importance of sleep, which I know gets difficult as you balance everything that comes at you in life. But I would say sleep research, sleeping well, that's something that I try to do to age well. And then I would also say just staying up to date with research and um, reading articles about the best things to do for your health, because right now at this time in the world there's a wealth of information. Not all of it is good, some of it is misinformation, so it's important to go to those trusted sources and look at the things you can do to possibly preserve your health or prolong your life a little bit.
Great. You're underscoring one of our pillars, which is good sleep hygiene for aging well. So,
Yes. It's very important.
and it's a challenge. I know that's one of the things I'm battling with right now is trying to figure out how to improve my sleep quality. And I track it, monitor, and all that, and you know, figuring a few things out here and there, but I got a long way to go.
And I'm sure it
And
ebbs and flows a lot. I'm saying this as someone who doesn't have kids, has way less responsibilities probably than most of America. So I think as you age and get older and take on more responsibilities, it's something for me to keep in mind that sleep is a priority, and it should be a priority.
but it's one of those habits that we don't build in college. So I'm
Right.
impressed that
That's
you're
true. We
working on it now.
probably do the opposite of build it in college too,
Right.
but I try to get good sleep.
Good. And so, how can our listeners and viewers connect with CareYaya? You've mentioned that there's a web page. Is there any other social media or anything? Or and also, how can students who want to participate? How can they get involved? How can they get connected with CareYaya?
Yeah. So you can find CareYaya at careYaya.org. We also have a LinkedIn called CareYaya Health Technologies, and that has kind of a mix of healthcare information that our staff like post and ways to sign up. So you can also go on there if you just want to stay up to date on what's going on in the healthcare world. And then we have an Instagram called We Are CareYaya. If you are a student who is interested in joining CareYaya, you can go to careyaya.org/FAQ and see if your university is eligible as one of the ones that has CareYaya student caregivers. And then you can use our website to apply to be a caregiver. There's an I'm a student page, which is where you would go to find more information.
Okay, and how about an institution? How can I push like Western Oregon University to get connected with CareYaya?
Honestly, I think reaching out to our team, if you are someone at a university who has an interest in maybe finding a student population that would be well fit for CareYaya, then you can reach out either on any of those platforms, honestly, that I mentioned before. Again, our insider team is fairly small, so we will see it and we will reply.
Yeah. All right. Well, is there anything we've missed talking about that we want to make sure that the viewers and the listeners get so that they get connected to CareYaya and have all the information they need?
Anything we missed? I guess just if you are a member of the sandwich generation and you are looking for a way to kind of another source, provide care for someone you are responsible for, that we are a very trusted solution. And we would be eager to work with your loved one, not just signed up to, but happy to and eager to and motivated to provide that care.
Great. And some personal questions. So what kind of medicine are you looking to practice?
So I am actually not as sure as time goes on, which is an ironic answer because I think people usually become more sure. But I have just found so many different specialties that I'm interested in the more that I get exposed to them. Initially, I had thought neurology, which is still my top contender. I'm very interested in neurology. But now palliative care could be on the table for me, potentially immunology. I've had some really interesting immunology classes. So I would say something in that sphere, either neurology, palliative care, or immunology is probably where I'll end up. But once I get to the rotations in med school, that could change again. So
right.
I'm open to different options.
And you could probably find somewhere in between all of that as well, I would think.
Right.
When we think like
there's
Alzheimer's care and some of those types of things.
there's lots of overlap. That's the cool thing with neuroscience. I've always been fascinated by memory. So there's big overlap between neuroscience and palliative care. Neurodegenerative diseases are very interesting to me. So that could be an area of focus for my research in the future.
Well, you'll have to listen to, we're recording kind of a follow-up episode. We interviewed them last year. I think it was episode 120 for our podcast. We interviewed Emily and Mitch Kalansky. She's a medical doctor. He's a psychologist, but they wrote a book on, dementia care and causes of dementia. And they were just a fabulous interview last year. And we're interviewing them again this weekend. And I think their episode will probably air like one or two episodes after yours, but they're a really, really great source for information about kind of the areas that you're interested in. So I might have to connect you with them.
Awesome. I will have to give that episode 120 a listen, and I'll keep my eyes out for their upcoming one.
Yeah. Well, this has been a fascinating discussion. I love having a younger person now on this podcast. We tend to get into the older generation a little too much. So maybe having a young face on here might open up some of those 18 to 30-year-olds that we could get listening to the podcast. But I hope this also alerts people to the opportunities that they have either as a caregiver, as a student, or as someone who is in need of care for their elder. And so I just appreciate you coming on today. I just thank you and wish you all the best in your decisions about medical school and your continued work with CareYaya. So you just have a great day. And it's kind of hard to say it to a young person, but it's easy saying it to an older, but we always end with keep aging well.
Thank you. Yes, I'm very grateful for this opportunity to come on here and talk about CareYaya. And thank you for being the platform for my first podcast. So,
well, I hope there's many more.
Exciting opportunity.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.